Hello, everyone, and thank you for joining our session on the role of community based organizations in promoting health. My name is Dr. Sandra Melvin. I serve as the CEO for the Institute for the Advancement of Minority Health, and I also currently serve as the health chair for the Mississippi State Conference of the NAACP. And joining me today, I have three phenomenal panelists: Dr. Erica Thompson, Mr. Michael Marks, and Dr. Mary Hosley. And so I will introduce each of our panelists before we get started, and then we will have a really engaging discussion about how important it is for communities to work towards promoting health. So, Dr. Erica Quinn Thompson is the founder and executive director of Magnolia Medical Foundation. Dr. Thompson, through her organization, addresses complex public health issues related to community health, economic empowerment, and workforce development through the three locations of Magnolia Medical Foundation: Natchez, Jackson, and Gulfport, Mississippi. Dr. Thompson earned her Bachelor of Science degree from Tougaloo College in Tougaloo, Mississippi, a doctorate of medicine from Brown University Medical School in Providence, Rhode Island, and a Master's of Public Health degree from the University of Southern Mississippi in Hattiesburg, Mississippi. She has more than a decade of experience in health program services, management, training, and evaluation. She has more than a dozen peer-reviewed journal publications and medically related certifications. She is also the author of a daily devotional entitled The Transforming 31 Days of Process for Purpose, written to encourage and uplift women and girls. Welcome, Dr. Thompson.
Thank you for having me today as one of the panelists. I appreciate the opportunity to share.
And our next panelist is Dr. Mary Hosley. Dr. Hosley has been an active member of the NAACP since 2003 and has served on numerous committees. As a longtime healthcare professional with many awards for her clinical and academic work, Dr. Hosley has long been active through her service as chair of the Health Promotions Committee of the NAACP from 2003 to 2010 and from 2015 to the present. Dr. Hosley is recognized for her past service, but particularly because of her recent energetic work during the pandemic. One only has to search Dr. Hosley's CV to see that her entire career has been built on service to low income, high risk communities, which have also been the subject of her publications, including her dissertation, Meeting the Nutritional Needs of the Very Low Income Type 2 Diabetes Patient. In 2021, Dr. Hosley joined a campaign called Pine Belt, This is Our Shot, with the Vaccination Equity Initiative, which is part of the Microsoft Global Vaccination Equity Initiative, a coalition of nonprofit and healthcare groups organized to address health services in underserved communities. Dr. Hosley's remarkable life and career of service have been marked by her long list of earned degrees, her vocation as a medical professional, her publications, her service in many professional organizations, as well as many community activities as a mother, as a member of the church where she serves as an ordained minister, as well as her work in the NAACP. Despite the pandemic, her recent activities in developing business have been recognized by an award from the Business Empowered Mississippi with a letter of recommendation from Governor Tate Reeves. She has also been recognized as a Real Power Healthcare Professional of the Year in 2019 and Collaborator of the Year in 2021. She is also the author of two books, 30 Days of Prayer for Frontline Workers During the Pandemic and Tributes to Life's Trials and Tribulations. Welcome, Dr. Hosley.
Thank you. Good to be here.
Mr. Michael Marks is a former Mississippi Teacher of the Year, National Milken Educator, and America's Outstanding Teacher of the Performing Arts, currently serving as National Executive Director of Schools Against Vaping. As debate coach at Hattiesburg High School, he qualified students to national tournaments in every event. His mock trial teams claimed 8 state championships and as many top 10 finishes in national competition. As a playwright, his Hattiesburg High School docudrama, The Katrina Project, Hell and High Water, toured the continental United States, including a performance in Dallas at the National Forensic League tournament, and enjoyed a command performance for Congress, and also received the NEA's National Human and Civil Rights Award. As former president of the Mississippi Association of Educators, he once negotiated a 36% pay raise for his state's educators. A founding director and former president of the Mississippi Pageant Local Directors Association, he holds the distinction of having his contestants win the state title for a record 4 times. He currently is a member of the Public Relations Association of Mississippi. He is co-author of the book Katrina, 10 Years After, and serves as vice president of Downtown Hattiesburg Association and on the boards of Promote the Vote, Southern Mississippi Partners for the Arts, Mississippi Miss Hospitality Competition, Pine Belt Foundation, and CEO for the educational and arts consulting firm Stage, Style, and Study, LLC. He is president of the board of directors of the YMCA of Southeast Mississippi. He is a brother of Omega Psi Phi fraternity and a lifetime member of the NAACP. For his exceptional community service, he received the Martin Luther King Jr. Award from his alma mater, the University of Southern Mississippi. Welcome, Mr. Marks.
The pleasure is mine.
So why don't we get into our discussion? This workshop will be important because it will focus on the importance of partnership, coordination, and collaboration in promoting good health in communities. Through this discussion, we will talk about specific examples of how community-based organizations have been instrumental in addressing community needs in response to health disparities and in response to natural and man-made disasters. So why don't we get started? First thing I'd like to do is for each panelist to share a little bit about his or her respective organizations. So we will start with you, Dr. Hosley. Why don't you tell us some of the important work that you've done in the community and why this is such important work for you?
Well, to start with, I've been very active since the beginning of COVID. My daughter and I have sewn over 2,000 masks during the beginning of the pandemic and shipped them throughout the USA from New Mexico to New York. And it's just a passion of mine to be able to, as an ordained minister, to be able to help people, to help others, to make sure that they have the adequate health care that they need. So I've been busy doing that. And also during the beginning of the pandemic, when the vaccine became available, I registered over 2,000 of our citizens, the elderly and the high-risk population. I went from door to door, registering those who didn't have the means of the computer or the internet or iPhones, or not only did they not have those items, but they didn't even know how to access the internet. So I registered over 2,000 of our members here in the community to receive the vaccine. And they did just that. They got their vaccine, and also taught a computer course to all the residents at an elderly facility, teaching them how to register themselves and register their family members to receive the vaccine. So it's very dear to my heart. I'm a registered nurse by trade. I taught at the University of Southern Miss in the baccalaureate degree program there for nursing. And it sort of kind of goes like hand in hand, being a registered nurse and then being an ordained minister too, reaching, caring, and healing. That's just what I do. And that's what the platform, even at NAACP, have played a big role in allowing me to get out in the community and make a difference, especially in those who are battling COVID or have questions about it and the vaccine.
Magnolia Medical Foundation was founded in 2009 to address disparities in health and provide preventative services and capacity building to individuals, families, and the community. We have 3 pillars: community health, where we deal with chronic disease prevention and management; teen-friendly services for teen pregnancy prevention, mentorship, and opportunities. We also have a project where we support mothers and those individuals working with mothers. Our second pillar is economic empowerment, where we assist families with pre-purchase home buying. We help them with housing counseling and credit counseling, debt cancellation, just all resources around dealing with money and economics. We have our last pillar of workforce development, training, and internships. This allows us to be a resource for those students who are looking for opportunities of internships and need preceptors to assist them with their research and graduation requirements at most of our major universities and colleges. But it also allows us to work with students to share our various disciplines within public health and health care and provide them with opportunities to serve in a nonprofit setting, but also opportunities to have a fulfillment around providing services and support to others. We provide those opportunities throughout the state of Mississippi, although we do service our main targets within our 5 geographic locations of Jackson. Well, we have 2 locations in Jackson and South and Midtown. We also have a location in Gulfport, a location in Moss Point, as well as Natchez.
Well, the first thing I can tell you is that I'm grateful for this forum, which has brought several NAACP members together to think that Dr. Hosley and I share a city, share an alma mater, share a community, and have never had an opportunity to work together. So I'm grateful for that synergy as well. She's provided a lot of leadership for Vaccine Equity Initiative, which is an official Mississippi organization. It's the first time in our state that the national VEI has sort of ordained a community to be ready for this work to help save lives during the pandemic and to provide some real education in our communities around people who have vaccine hesitancy. We know that people are hesitant for a variety of reasons. It could be historical. We remember the Tuskegee experiments. It could be political, social, a lot of it is. And then we also have to fight the tremendous wars that are being waged on the internet with misinformation. So the whole goal of Pine Belt, This Is Our Shot, is perhaps to serve as a model for the rest of the state on how our community can attack and mount a community education project. We know that there are a lot of vaccination sites in our state. That is not the problem. There's literally one on every corner, and we endorse them. You can never have enough of them. The problem is that we're not changing minds. So our entire goal is to provide accurate information, particularly to communities of color and to young people, the 2 entities that are most left out of traditional healthcare circles. We witness other vaccines that say, trust your doc, get a shot. So what happens if you have no doctor? What happens if you don't have a healthcare plan? Who addresses those people? And so that's our real goal. So as I said before, it's my pleasure to work with Dr. Hosley to provide the beginning and the impetus for this campaign. And we expect for this to go on for a while. On the education front, I am a retired 30-year educator, and so most of my life has been about providing accurate information. You mentioned the Katrina Project and an opportunity to heal our state after that Category 5 disaster. There were so many people that were left out of the loop. When you talk about communities of color, and it wasn't just Black people, and it wasn't just the indigenous people of Mississippi, there was a whole community of Vietnamese who literally drowned on the coast because nobody told them what was coming because they didn't speak English. And we have to be cognizant of the way that COVID has exposed the healthcare disparities in our state and in our country. We know that people of color are the last to receive that information. We know that we have problems processing that information. So part of the campaign that we're launching with This Is Our Shot is to provide credible faces and people that you trust to provide information. So I've had a rich opportunity throughout my career to be involved in providing education. As a former leader of the National Education Association and its 3.3 million members nationwide, I've had an opportunity to visit school districts throughout the state and throughout the country and throughout the world. I know what healthcare disparities look like. If you've never been to India and to be there when the billionth person was born, you don't know what poverty looks like. It is abject, and we have to do better around the world. So I'm grateful for this organization that has given me an additional platform to help save lives.
Thank you for that, Mr. Marks. You brought up some really interesting things that were happening in the community that really affect our community's ability to be healthy. So I want to follow up on some things that you said, and I want to ask this question to both you and Dr. Hosley. What characteristic of community-based organizations make them particularly suitable to address public health needs in our most vulnerable communities? And we'll start with you, Mr. Mark, since you initially laid out the foundation, and then Dr. Hosley, I'd like you to add on after he has addressed the question.
I think one of the things that makes us uniquely potent as problem solvers as a community organization is that element of trust that I talked about. You know, the old saying in politics, particularly in communities of color, is that, you know, you tap preachers and teachers and barbers and beauticians. And really what we're saying is that people that you know, people that you trust to give you intimate and accurate information. And I think that that is the one relationship that we can exploit in bringing accurate information to communities of color. There's a lot of information out there. A lot of it is correct, but a lot of it isn't. And so what we do is we tend to tune things out. But when your neighbors speak, when your preacher speaks, when your teacher speaks, we tend to listen. So I think we have to be able to wrap messages in vehicles that look like me and sound like me. And that would be true for everybody that is in a community of color. We want to hear those messages, but you know how it is. And particularly in Black communities, the messenger sometimes is more important than the message.
I agree. I agree with everything Mr. Mark has said. And I've found out in my quest to reach people of color, especially, we have to be relatable. We have to go where they are. We have to actually get in the trenches. Boots on the ground is one of my mottos, is boots on the ground. And we go door to door knocking, or we walk the streets of those neighborhoods where we find the people that we're trying to address or trying to meet those needs. And that has been most important. And yes, they trust the preachers and their pastors and ministers. It helps to be one of them. It helps to be have grown up in the neighborhood in which those people you're trying to reach. And I found that out as I was going from door to door, hanging door hangers, that you have to meet people where they are. You have to get in the trenches. They have to feel that you actually care, and there's a genuine care and love for them, and that you're not just out providing lip service, but you're you're walking the walk, you talk the talk. They want to make sure you're walking the walk and that there's a genuine care for them and their well-being. So it's important that we're relatable and that we meet people where they are on the level they are. And that's hard to do if you hadn't been there, if you hadn't lived in the project, if you haven't lived in those communities that of where our people are. It is so important that we relate to them where they are.
I think those are some great points. And I will tell you that from my experience as a community person and a person that's worked in the community for almost 20 years, there is just a trust factor.
Yes.
Our communities don't easily trust people. So most of the time, community-based organizations are more uniquely situated because people already trust us. We know where they're coming from. A lot of our experiences are the same. We come from the same neighborhoods. And so I think that element of trust is something that really adds to us being able to work with communities. Dr. Thompson, at this point, would you like to add anything about what you think makes communities uniquely suited to address some of our most pressing issues?
Just to point out some unique positioning for community based organizations as we address public health issues. One thing that I have really found with during the time that we have seen with COVID, once COVID really began to become a true presence in our communities and a true presence in our health systems and really began to affect every specific order of our beings, per se, it was affecting our distributions and our ways of work and place and childcare. It really affected a lot of issues related to public health. And so, one of the things that I really realized was that community based organizations, we knew they were important, but during this time, they became very, very vital to the process of providing care and services. Sometimes, we may think that small organizations can be a bad thing to be small, but what I would say is that community based organizations that were the smaller organizations, whether they were in the community, they were at the pulse of the needs of those families and individuals that they served. So it allowed us as community based organizations to be nimble and quick. We were very pliable and flexible, and we were able to really answer the call of the needs and to have a need based sensitivity for those that we serve. And so, whether we were initially really focused on maybe tobacco or some of the other public health issues, because we had our ear to those of the community, we understood what the needs were rather quickly and were able to pivot and be available with resources. So immediately, our organization, and we have tons of partnering organizations like the Institute for the Advancement of Minority Health and Six Dimensions and the NAACP, we were able to work with these organizations to get information out about COVID, to provide services around cleaning supplies, basic things such as water and food. And these things, although they were shortages in some of the stores, we were able to get our hands on some of these and get it to those communities, especially those that were in rural communities, to our seniors who may have not had transportation. And so all of these were very, very important. And we were grateful also to our funders because we were able also to actually say, hey, we're here, we are in position, and we're able to get these resources immediately to the people that we serve and those within our serving area. And this really put community-based organizations into a great position. Also, community-based organizations, I would say, are that trusted trusted voice in communities. People know us. We're not the new person showing up just in this particular crisis. We are here for you in any time and any crisis. We want to make sure that we're supporting you at all times, not just in one day, but 365 days of the year and for many, many years to come. And so those that know our organizations and community-based organizations, they know that this is what we do and what we want to do, and that even in the midst we will be here, and even in the after we will be here.
So, another question that I have of you is that we understand that a lot of times resources are stretched. There's so many problems and not enough resources to adequately address all of the issues. So, from each of your perspectives, how important do you think that partnership and collaboration has been in helping you each to achieve your missions and goals for your organizations? Dr. Hosley, I'll let you address that issue first.
Yes. Well, to be honest with you, I haven't had a lot of funding resources. Everything that I've done and my family have done, it was out of love, and I came out of my own pocket. For a lot of these things, but it is very important. The State Department of Health and Dr. Melvin, your initiatives and the groups and people that you work with have all been and played fundamental parts to the resources that I need, whether it be educational material, backpacks, all just masks, sanitizers, things like that. It means so very much, and it helped me to reach my goals when I would put on workshops and do seminars for people in the workforce. And I've even done a seminar for some of the young people at a school, 3rd through 8th graders, and we were able to provide them with educational resources that we obtained from your office and the State Department of Health, Mississippi State Department of Health as well, teaching them how to wash hands, how to cover their coughs and take care of themselves, the hygiene part of taking care of themselves. So I haven't had a lot of funding resources until recently, but it is very detrimental to the well-being of our people and to the programs that we're trying to get out into the community and perform.
Dr. Thompson, what are your thoughts?
It is important for us at Magnolia, as I mentioned, about partnerships, because partnerships help us to build bigger and better. That's how I always think about having partnerships. As I stated, we have a ton of partners. We have a lot of resources. We understand that this work is multifactorial, and so it takes not only just one organization, but multiple organizations bringing their resources to the table. We also realize that there's power in the numbers of us working together, because we're able to bring those resources together and reach more people. I always share about the sandbox analogy, that when I'm in my sandbox by myself, I can only think only what I'm thinking. I can only create what I'm thinking to create. But when I'm in the sandbox with like Sandra or someone else, or with Dr. Burse or other people, I can actually think about what else can we build. When I get on the phone and I can call another organization and say, hey, I'm thinking about this, many times we're able to then come together and create something that probably both of us had never thought about initially. So the impact becomes massive. So not only are we just touching in one particular area, but now we're able to spread our tentacles out and really have a greater impact. And so the greater number of us coming together to do this, the greater the outcome. But also the synergy of working collaborative brings about greater resources. And so in that resource, we are able to support the cause with less duplication of services, but then allowing evolution to see what else can we do, what else is necessary. As I always like to say, every joint supply is something, and so whatever that supply is, we all need it. And so it's something that each of us have that is an asset. And so together it becomes even a greater resource. And so I am a true proponent and supporter of partnerships and collaborations. We also understand that during this time, the perspective of what should the government's responsibility be for public health, one thing is we know that it is imperative to have equitable policy that is inclusive for all, and providing resources that will improve outcomes and generational health and wealth. Those resources and responsibility that is just not for today, but we have to look into 2030, 2040. We're looking further down the line of what these health outcomes should look like. What are the measures we need to take today for our children to ensure greater health and better health outcomes and resources for them?
Mr. Marks, what are your thoughts about the value of partnerships in helping you to achieve your mission and goals?
Listen, I think we have to have partnerships. It really does take a village. And no one person or one organization can ever be as strong by themselves as they are working in tandem with others. Uh, I'm a retired teacher. I know how to beg. I know how to form partnerships because they're crucial to underfunded missions that are of value. I have worked a lot with former students who are across the country. I can remember when there was an outbreak of the West Nile virus in Port Gibson, and then again in Tupelo. And I was able to partner with a former student of mine, Jeremy Hirsch, who is now the CEO of Spartan. And we were able to go to those communities and not only provide food during the pandemic, but also provide mosquito repellents and things that would help them save their lives and from West Nile and other vector diseases. But I also know the political value, and I guess the NEA taught me this in my life of dealing in the political structure as president of the Mississippi Association of Educators. We've also had to learn to farm our team out for public presentations to the Lamar County Board of Supervisors, the Forest County Board of Supervisors, local entities. I serve as president of the YMCA in our community. They too have been helpful. And we had a Healthy Kids Day back in April, and I was amazed at the health community, particularly mental health, because that was a huge problem, and it still is as a result of the pandemic. But all of these entities were able to give us much needed funds because Dr. Hosley's right, lip service only goes so far, and at some point, you have to be able to fund a mission. And so I've learned to tap into those organizations by finding out what our common values are. People say, well, you can't talk to them, they're Republican, or you can't talk to them because they're Democrat, but there are common values. Nobody wants to live in a community that's not safe. Nobody wants to die. And so sometimes it's just a matter of finding out what your shared value is. And once you get a foot in that door, where you can have a decent conversation, I think miracles are possible.
Those are some great points. And I will tell you that when you're leading a nonprofit organization, you definitely have to learn the art of the ask. And you also have to learn how to play well with others. So thinking about where you have shared missions, shared goals, it goes a long way in helping to get the resources that you need. And also the other reality is, as a nonprofit, a lot of times you do come out of your own pocket, because even when you get funding, that funding is targeting specific things. You give the funder a budget. And so if you find that you need something else to be there to help this project be successful, a lot of times you end up taking it out of your own pocket. So definitely there's a lot that goes into working as a community-based organization in promoting health. So, and with that, I think this is a good place to also talk about how does the community take ownership of its own role in promoting health equity. From your perspective, Mr. Marks, what do you think is the role of the community in promoting health equity?
I think the community has to have an overall leadership role. Sometimes it's encouragement, sometimes it's financial, sometimes it's giving access to infrastructure. But I think the community has to have some role in providing leadership for major projects, particularly those of a healthcare nature. The other thing that I've learned is that I think sometimes we're too polite. Sometimes we wait for others outside of our community to give us permission or to invite us to be a part of major movements. What I've learned is that waiting is not always good. Sometimes you have to have a leap of faith, and sometimes you have to strike out on your own. I woke up one day regarding this. Um, the pandemic and what we could do to save lives in communities of color. And I said, what are you waiting on? Who are you waiting on to give you permission for what you know you need to do to help your community? And that was an impetus to action for me. And so that's why I was so grateful to be linked with the Dr. Hosley, who certainly has the boots on the ground experience and provides a great resource for our team. But I think that I was waiting for somebody to bless the movement. And sometimes you just have to make that leap of faith and do what you know is good. So I think communities have to give encouragement, but if they don't, that cannot be an excuse for inaction.
Dr. Hosley, what are your thoughts?
Yes, responsibility. The community, the leaders in the community need to acknowledge that they're responsible, or they should be, when they take that oath to get in office. Then they need to be responsible. That goes back to having a sincere heart of caring about your people that you represent. So responsibility is a big part of who I am, and who I think those who are in leadership positions should be thinking about. Is, who am I responsible for? What am I to do for this people that are dependent on me? The leaders also need to have a good listening ear. Are you surveying what your community needs are, especially during the pandemic and during the COVID-19 with its different variants? You have a good ear, have good eyes to see what is happening in your community, and what are the people saying, what are their needs, what are the people's need in the community. But to me, that is very important, to listen, to care, to look, and then move. You need to do something about whatever the needs are that the people are reaching out or looking for. If it's educational material, if they need to have answers to some questions, if they've heard a lot of different myths, especially on our social media platform, on Facebook, Instagram, clarity, hold some town hall meetings, get with the leaders within the community, and come together to host town hall meetings in order to reach those people, and see what their needs are, and then actually move and do something about it. Not just talk the talk, but actually get, again, boots on the ground, door to door, see what their needs are, and then move, do something about it.
Thank you for that. And Dr. Thompson, would you like to add your thoughts about what you feel the role of the community is in promoting health equity?
The role of the community in promoting this health equity, whether health is the end or it is the means to an end, communities can benefit by understanding how health is connected, and to understand all of the important parameters that work. Everything that we do collectively in work, our play, worship, education, housing, employment, all of these things help to improve health and mitigate health inequities. And so it is imperative that we promote equitable access to these resources, but also empower folks with the abilities to interface in these different sectors, and then make it available for us to come into the sector. And so I think it's so important that we do have all of these various community based organizations and organizations that do certain things as it relates to advocacy, policy development, because all of these things help to shift and to actually help us to be able to interface more and break those barriers, and to actually reduce those barriers and actually be able to have that equitable access.
And Dr. Hosley, I'd like to just add on or latch on to something that you said in your response. You stated that leaders need to take action, and we know that often there are people in the community that are perceived as leaders. But there are other people in the community that may not necessarily be seen as leaders, but they are part of the community. What can we do about those individuals who don't necessarily see themselves as leaders, but could definitely be very instrumental in helping to reduce health disparities in communities?
Yes, yes. Leaders can be not anybody, but those people throughout the community who people look up to, who they reverence as people they can trust, such as your barbers, your salon stylists, ministers, pastors, of course, your supervisors, the mayor, your doctor, the nurse practitioner. It can be a Girl Scout leader. I served as a Girl Scout leader for 30 years, and I lived in the project here in Hattiesburg, and they can relate to you because they remember you growing up. They remember you being that little bitty girl or that little twin or the little bitty boy that people didn't think was going to be anything. So those people are relatable. It can be your landlord. It's anybody who people can trust and feel that they're trustworthy and that they have something to offer you, and that the people feel secure knowing that you are a sincere person and that you have their good at heart. Those are the people. Those are the ones that I talk to. Those are the ones that I communicate with. My barbers and my salon stylists, and the people who others can look up to. I have known throughout the community during all of their years from childhood to adulthood.
Mr. Marks, would you like to add anything?
Um, the other thing that I would add, and I'm not sure it's peculiar to this point, but Dr. Hosley talked about leaders. And when I say you can't always wait on leaders, is that political leaders, elected leaders in particular, can sometimes be compromised. They do what they should do to lead, but the problem is often they have conflicted constituencies. So who do you help? So when you go to a group of 5 or 7 leaders who represent a political entity, they each could have different constituencies. So what is good for one constituency may be the absolute worst thing for another constituency. And that is when the explanation of social media and how we target messages becomes crucially important. But being a good leader is about being able to decipher the path to help those individual constituencies. There is always a way to help. I taught for 30 years, and I know very well every student learns differently. You have those who are visual, you have those that are oral, you have those that learn by touch. It is our goal to find out what works. Every community has a vibe. Every community has a way that it functions. And we have to tap into what makes and drives a community in order for a message or for a mission to be important and to be successful.
I agree. And I will also add that sometimes people don't know that they're leaders until they don't have a choice. And I think that was definitely highlighted during this pandemic. People stepped up, barbers, beauticians, people that we don't traditionally look at to help us to do the things that we need to do to keep our communities healthy. But they stepped up. Churches have always been important leaders in the community, but even in terms of our relationships with faith-based organizations has been strengthened during this time. as well as our work with agencies, state agencies such as the Mississippi State Department of Health. So I will say that leadership comes in many forms, and sometimes you don't know that you're the leader until you don't have a choice but to take on the role. So definitely, I think that communities have a really important role to play in promoting and improving health. Is just finding out our strengths and weaknesses, and then playing on to the strengths that we see from different individuals in the community.
I would like to add something else to that too,
Sure.
Dr. Melvin. Our local chapter of the NAACP has played a big role, a large role in allowing our platform to be utilized to host and to sponsor vaccine events throughout the city. We partner with Moss Point Visionary Circle, Jackson, Richland, Mississippi, Marion County. We've been all over the place. So our local civic and social organization, even some of the Greek life members as well, have played big parts in connecting with our community of people as well. So I would just like to commend them on allowing such platforms to be utilized at such a time as this.
Thank you. And since you did bring up the NAACP, I'll just make a plug for the fact that the state office also helped distribute thousands in face masks, sanitizer, and in partnership with other organizations, we've been able to vaccinate over 500 individuals in this state. And when we look at impact, we can see our numbers have gone up. They're still not where they need to be, but in terms of having hard data to show that the efforts of community-based organizations are working, we know that we've gone from 20% in vaccination among some African American communities to 40%. So we are making a difference. So we should never underestimate the power of our local NAACP branches, community-based organizations, faith-based organizations, and the power of partnership to make things happen. So thank you for bringing that out. I think that is an important fact that we need to bring out. So one of the things that I do know is that we do a lot of work in communities, and often we're so busy doing the work that we don't step back to think about how to share those lessons learned. So in your individual work, what do you do to make sure that when you get information that may be helpful to the community, what are some strategies that you use to get information out into the community?
Well, I guess I'll go first. The communication, we use flyers. We have composed and put together brochures. I use a lot of texting and emailing to, say, landlords at different projects here in the community. Faith-based community, we reach out to our pastors and ask them to share with their congregants or their parishioners. We use a lot of social media and word, we go word to word or whatever, person to person, letting them know what's going on to keep them abreast. And Mr. Mark has known as well. We got radio stations. I've sit on a panel list with some of our local radio stations back earlier part of the summer here. Myself and one of the other NAACP leaders, our president, we actually participated in a radio program where we were talking about COVID and vaccinations, television commercials, when we were getting the word out about the vaccines and the effects of it on our television stations. I've been on a couple of television stations as well, performing as far as commercials and getting the word out that way. And then word of mouth and just my telephone, when I was on television and announcing that we will be given the vaccinations, I've actually gotten calls since the beginning of 2020 with those clients clients that I registered to receive the vaccination, they will call me and let me know how they will be doing or ask questions about COVID or the vaccine, or what about the second shot and booster shot. I had a few to even just call me to let me know how they were doing. So all those avenues are what, some of the ways that we communicate with our people in our community.
Okay, thank you. Mr. Marks, would you like to respond?
Sure. I had the pleasure of serving for a decade as Director of Public Relations at Forest General Hospital here in Hattiesburg. And one of the lessons that I learned in dealing with community relations is that you use every platform you got. Obviously, we go to social media with Facebook and Twitter and Instagram, Snapchat, all of the regulars, but we also should not ignore print media. We shouldn't ignore magazines. We shouldn't ignore newspapers. We should enhance television and radio, and whether that's a public service announcement or a talk show or a forum like this. You never know where people get their information, and America is as varied in that as anything I've ever seen. So don't put all of your eggs in one basket. All young people are not on Twitter. All old people are not reading the newspaper. Every housewife is not on Facebook. So you have to have a blend, and you've got to have a message. I share Dr. Hosley's experience. I had someone call me the other day that I'd not talked to in 10 years, but she saw a public service announcement that I did on local television, and she wanted to be a part of the COVID campaign. She said, that looks like something I want to be a part of. So I wanted to call you. And she did. And she called me to talk about it. And so I think we have to be willing to share in every way, in every vein. And that includes witnessing in organizations that we belong to. Sometimes the best communication comes from sources that we take for granted. So when I'm downtown and I'm talking to the Downtown Association and they're planning events for the year, so what is it that I put to the table that can impact communities of color? When I'm at the YMCA and people are talking about events, how can I make sure that there is diverse inclusivity? So all of those things have to factor in, and we have to find a way to help ourselves. But certainly, if you are only experiencing things and keeping them to yourselves, you're helping nobody. It is about sharing the wealth. It is about every experience leading to a better tomorrow, and helping to have better health care in our state. The one thing that I appreciate about the Vaccine Equity Initiative is that it is COVID right now because that is the fire that's burning brightest and deserves our attention, and rightfully so. But the overall goal is 10 years from now, how can we change the trajectory of healthcare for communities of color in Mississippi? And I think that that's a powerful statement and a vision worth embracing.
So one of the things that we did was it was very imperative, especially during the time of COVID, for us to be able to allow people platforms, the community platforms, to share their fears, to share the myths that they had heard, to share the questions that they had, and provide these platforms in a non-judgmental way where people felt comfortable saying, hey, I really don't know. This just seems like history again to me. I'm not sure if this is for me. Show me how is this possible? This was made too early. Whatever those questions were, they owned what they felt. And then we provided resources, bringing in the medical providers, bringing in the faith-based leaders, bringing in education leaders, because people wanted to know, how will this affect my children for school? How long will school be closed? All of these were questions. And so by having these discussions involving the community, providing those resources, providing accurate medical information, showing those resources, dispelling those myths, empowers. And then building that community of power, and then offering strategies of how we continue to disseminate this adequate information that's medically accurate and information gets trickled through our communities now that not only is that is empowering, but now is ours to share. And so this was a very empowering situation for me, working with Magnolia Medical Foundation and other organizations like the NAACP, and working with the Institute and others, for us to be able to bring these listening sessions, bring these people in to the community so that we can find out, what does this mean, asking those questions of our governmental entities, involving them to come and speak, individuals from the Department of Health, so that we would know. And so then it was very important too that we were able to disseminate supplies that were needed. It was imperative for people to have masks. It was imperative for cleaning supplies. It was imperative. So all of these things were necessary. And then being able to put them into places where individuals were going in the community and they could readily access these, and they were free. So people did not have to choose whether I need to buy toilet paper or the Lysol, or I need to buy a mask. And people were selling masks at that time like $5 and $10 a piece, and I have 5 children, that's $50. We were able to provide those for free, and that made a difference. So being involved in discussions, building that community power, and then offering strategies and resources. Some of those strategies also include sharing that information, as I said, on public platforms, but also making sure that the information is culturally, linguistically appropriate, and that it speaks to every particular population. On the coast, we have had the privilege of working with the Biloxi NAACP and Chama and some other groups there, but we have also been able to work with the Hispanic community. And so our community health workers do a ton of services to the Hispanic community, and we have community health workers who speak the language, who know the culture, who are from the community, and this allows them to be able to interface and be that trusted voice, but also to provide the information that looks like the people on the pamphlet to the people. And that for us is so important, because then I connect with those resources and I understand that these resources are for me. And so we want to make sure that for Magnolia, for us, that when individuals come to us for services, we're able to have services that meet individual needs, but meet their cultural and the needs that they need specifically for them and their families.
So, as usually is the case when you're having a great conversation and you're learning so much from other people, time is flying by and we've come upon the hour. So, I do want each panelist to answer one final question, and then we will say goodbye to everyone. So this question refers to challenges. You've all talked about the good work that you've done. You've talked about the role of community in promoting health. But let's talk about what some of your challenges have been as community-based organizations working to reduce health disparities in Mississippi. Can you identify some of those and just briefly tell us what you've done to address some of those challenges? And we're going to start with Dr. Hosley, followed by Dr. Thompson, and then Mr. Marks, you'll round it off for us. Dr. Hosley?
Yes, so challenges, and there are many. There have been many, and there will still be many more. But some of the challenges that I've faced in my work with this pandemic and the vaccine is hesitancy, because they don't trust. It goes back to their trustworthiness. They don't trust, and then fear. I've seen a lot of our men, especially African American, as I would approach them with a flyer or with information regarding the vaccine, I'll never forget those eyes as they looked at me and said, no. I'm scared. I don't know what's in that. I don't know what. And they would look at me, but I saw fear in their eyes. And as I, continued to talk and answer any questions that they had, I did get, a name and a number, an email address that this person and his girlfriend, he said, would come to our first vaccine event and they would try it. They would read the material that I gave them, but they did list their name as one of the recipients of the vaccination. But the trustworthiness of our people, and then the fear and just not being sure and not being educated, that has been the biggest challenge for me, is just looking into our people, their eyes. I had another a person that this group they sit under the trees in the neighborhood and play dice, whatever they do. Um, anyway, they walk through the church parking lot where we were hosting a vaccination event, and I almost convinced one to come and take the vaccine, their first shot. And then, but his two buddies walked up and said, no, 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 we're good, we're good. And they left. And so that kind of hurt, because I had another participant said, and those are the ones that's dying, middle age, young people and middle age adults. So the challenge have been more so is just trying to convince and educate and get people to understand what it is that we're trying to offer them, so that they can receive the treatment, perhaps the healing that they need. And we'll keep working on that. So every shot is in every arm that desires a shot.
Dr. Thompson, what are your thoughts?
Some of the greatest challenges as community based organizations, as we reduce health disparities in Mississippi, is we are constantly looking for resources. We are constantly having to write the next grant. We are constantly having to look for that next funding source so that we can remain first relevant to our communities, but also be accessible, but also have what they need when individuals need to interface with us. And so I kind of go back to an earlier question about why is collaboration so important. I cannot stress that having collaborations helps reduce those challenges sometimes that we face in reducing health disparities, because we're greater in number, we're able to do more, and it allows us to be more impactful and powerful. And so I have to always kind of go back to that. So some of those challenges is, accessing, being able to make sure that we get the information in a timely fashion, and then get that information out quickly as well. So that goes back to that nimble and quick that I mentioned. It's important to be able to move quickly, and to be able to make those strides.
Mr. Marks, how do you feel about what some of your challenges have been as a community-based organization?
Mhm. The major challenge that I have learned to respect is that the fear and the hesitancy is real. I have a hard time understanding why something that was invented to save our lives um, is a social problem or a political problem. I have a problem understanding that the pressure that you feel politically or socially is greater than death. I look around the world and there are so many countries that would give anything to have an opportunity at life, to have any vaccine. We have three, and a lot of us still don't take advantage of them. The fear historically that the government uses African Americans and people of color as guinea pigs, that fear is real. I have to work through it to be able to have a conversation. And I can't afford to even laugh at people who say that, well, I would get the shot, but it would impact my fertility, or it would change my DNA, or they're putting a chip in my arm. It's hard for me to process how sane people can think that way, but it is real for them. And the challenge is having to honor that fear and having to talk to them as if they matter, because they do. And when you're in the business of saving lives, you can't take anything for granted. I love that the Institute for the Advancement of Minority Health has as its mantra reducing health disparities in Mississippi, one community at a time. This is our shot, has taken a slanted on that. And our motto is saving lives in the Pine Belt, one shot at a time. So we all have to band together to do more. And our challenge is simply to understand each other more so that we're able to save lives and change the trajectory of healthcare in our state.
Thank you. And I'll just add two things that are challenges, real challenges for community-based organization, and that's funding and capacity. Anyone who has worked in this sector knows that not only are you out in the community, but there's an administrative side to this work that also has to be done. And usually we're small community-based organizations with less than 10 people doing a lot of work to serve a lot of people. So as you think about some of the challenges, a really big one is, of course, having the funding to do the work, but then also having the human resources that you need to make sure that you can effectively achieve your mission and goals. At this time, I'd like to thank Dr. Thompson, Dr. Hosley, and Mr. Marks for sharing your experiences. I'd like to thank you for the work that you have been doing in the community, both on COVID, but in other on other health issues in this state. We focused a lot on COVID because that's the hot topic and the thing that's most urgent right now. But I know that both of you have also worked on other things, providing resources for children through your back to school initiatives, your community baby showers, your tobacco projects. All of those things are things that you do in addition to the COVID emergency response efforts that you have done. And I also want to take a moment to thank the audience for joining us today. And we hope that we were able to share some important information that will help you to better serve your communities every day. Thank you so much.